Hello, everyone. My name is Mary Lynn Delfino. I'm an admissions counselor at Kent State University at Geauga in the Twinsburg Academic Center. And happy to welcome you today to our virtual major information session about respiratory therapy technology. And today, my co-host for this program is Bethany Bejo. Hello, Bethany.
Hello, thanks for making me the co-host of today's session. So yeah, everyone, thanks for taking a look at this video all about respiratory therapy. So we're going to go ahead and get started here right now. Let me switch this slide, and we have one more person to introduce to you. But first, we're going to go over real quick what the outline of this recording session is going to look like. So we are going to introduce Megan Alicia to you here in just a second. We'll give her time to chat about herself and who she is and what she does. Obviously, we're going to talk about what is respiratory therapy, which is probably why you're taking a look at this recording today, why you should major in it, and why you should major in respiratory therapy at Kent State specifically. And then what can you do with that degree? So those are kind of the main highlights that we are going to chat about today.
All right, so today we have Megan Alicia here with us, and she is a faculty member at the Ashtabula campus in respiratory therapy. So I don't want to give too much away, but Megan, we're so happy that you could join us today. And as you introduce yourself, we're also curious to know how you got into the field of respiratory therapy. So welcome to our information session, and we're going to turn it over to you.
All right, thank you so much for having me here today. My name is Megan Alicia. I am a full-time faculty for the respiratory therapy program on the Ashtabula campus. I have been a registered respiratory therapist since 2006. One interesting thing is that I do maintain clinical experience as well, meaning I still work in the acute care hospital. Which is something that's not common to all respiratory therapy programs. Many of the instructors maybe haven't been in the field or worked with patients in 20 years or so. So in our program, I still currently work in the hospital, and our director of clinical education still works in the hospital. To get into why I chose respiratory therapy, way back when I was younger, I was a single mother. I had no intentions on going to college prior to that, but after having my daughter, I decided that would be the best route to take. So I was looking for the shortest possible program in my community college that I could possibly take. So I started off in phlebotomy, drawing some blood, and then got into the paramedic program. So I started off as a paramedic, absolutely loved it. I love the emergency situations, traumas, that adrenaline rush. But I quickly realized I didn't really enjoy being out in the field. I really enjoyed my clinical time in the hospital. So I wanted to transition to something like that. So I was a paramedic, and I was on the waiting list for the nursing program. I had no idea what respiratory therapy was. I saw a poster at my community college about respiratory therapy, and just reading it over, I noticed several things that were similar to things we do as a paramedic. So again, that emergency, trauma, airway management, rescuing patients in life or death situations. So that really struck my interest, and I signed up that week and here I am. So it has really been a fantastic experience. I've had, so many amazing experiences and met so many awesome people over the years. It's been wonderful.
That's awesome. And yeah, the fact that you said, it had all the things that you enjoyed as far as being, a paramedic, some of those similar situations, to be able to find something that would keep you a little bit more stationary inside of a hospital or medical facility rather than out and about. So I think that's great to mention, because a lot of our students that pursue, allied health degrees or respiratory therapy are transitioning from maybe another career in the medical field, or going back to school, as an adult after they've had kids, after they've done a career shift. So the fact that you kind of have that personal background to be able to relate to those types of students is awesome, because we talk with students like that all the time. So that is important. All right. So what is respiratory therapy? I don't know a lot about respiratory therapy. And what I did know about it, I think, is not necessarily all correct. There's lots of different things involved in respiratory therapy that I was unaware about. So Megan, tell us a little bit, for those of us that come in knowing nothing about it, what is respiratory therapy?
I think in general, most people don't really know what we do. Even people we work closely with don't exactly know. But because we're usually mistaken for, another nurse that's at the bedside or something like that, or mistaken for the physician, something like that. So people usually aren't aware of what a respiratory therapist is and what they do. Basically, in a nutshell, we are cardiopulmonary specialists. In addition to that, so we do focus on the patient's breathing and cardiopulmonary functions. So we assist them with their breathing in any way we can. Another thing that, in addition to being specialists with the cardiopulmonary system, because that has to do with breathing and circulation, which are life functions, essential life functions, we do deal with a lot of emergency rescue, critical care situations. So that, for me, that's something I really enjoy about respiratory, is that we are always at the bedside when it's an emergency situation where we need to resuscitate and rescue the patient and assist them with their breathing. So if that's something you're interested in, respiratory therapy is perfect for you. If you are, a nurse, say you do work in intensive care, so you work with critical care patients, that doesn't mean you always have an assignment where you're working with the most critical patients. In respiratory therapy, those are the only patients we're seeing. So we are primarily focused on that population, and we become very comfortable in working with that population. So we're kind of like the go-to person to call when an emergency arises. We also work with patients that have chronic lung diseases. So if everything I'm talking about with the emergencies, trauma, intense adrenaline rush situation doesn't appeal to you, we also work in the more laid back situations where we might be working with patients with their chronic lung conditions like asthma and COPD. We help these patients, we educate them. We might work with a disease management program. They are coming out now with certifications respiratory therapists can take to become to work as an educator for these populations. We can work as case managers. There's also diagnostics. We can work in a diagnostic pulmonary function lab, the more comfortable, less intense Monday through Friday diagnostic testing environment. So there's kind of an environment for everybody in respiratory. Again, the one that appealed to me was the critical care, responding to emergency situations. We go to level 1 traumas, cardiac arrest, high risk deliveries, to manage the airway and breathing in these patients. We work very closely with physicians and all members of the healthcare team. So it really is hands-on, a lot of time at the bedside, assessing our patients and determining the care they need. So it's a really exciting field.
That's wonderful. And you've already touched upon a little bit about some of the things that you can do as a respiratory therapist. We'll be doing a little bit more of that later on, or hearing more about that. But we know there's lots of options in healthcare. And in your own story, you had explored some of those as a paramedic, as an aspiring nurse. But now that you are practicing in the field and now teaching future respiratory therapists, why respiratory therapy maybe over some of the other allied health fields that are out there, or why just this field in general? I think you've illustrated that it's not always the first field that people think of, but it has some really great perks and possibilities for people. So why choose respiratory therapy as a major?
I think I can, as a comparison to nursing and other allied health professions, Just in comparison to other allied health fields, something that I found very interesting that I learned early on is that out of all of those fields, respiratory therapy spends the most time at the bedside with the patient. So if that's where your interest lies, where you really want to be working closely with those patients, hands-on, providing care, then out of the allied health professions, respiratory therapy would be ideal. Obviously, out of people that spend time at the bedside, nursing spends the most time at the bedside. So in comparison to nursing, I think of it as if you really enjoy multiple things going on, kind of bouncing around, like I said, the nurse might have, this set of patients, or an intensive care unit have one or two patients, and they are focused on that patient or those two patients for the entire shift. Whereas I get to bounce around all over the place. So I care for multiple patients in my shift and call to emergency situations and just kind of getting all over the place. So if you really enjoy that constant excitement, moving around, rather than being in one place the entire time, then I think respiratory would be an ideal position.
Excellent. And some other reasons, of course, we know at regional campuses, students are very focused on career-oriented majors. And respiratory therapy definitely has a specific career pathway. It's very much in demand. So I'm wondering if you could talk a little bit about some of those factors that might help a student in their decision-making process. We see some great salary numbers, amazing demand, close to 20% over the next 10 years. So what are you seeing from your position currently? Does the reality match up with the projections?
Definitely. Obviously, salary is excellent. Many students really enjoy that and this is specific to the field of respiratory therapy, where after 1 year in the program, you can actually start working as a student respiratory therapist. So you start gaining that experience, start making that money after only a year in the program. So it's pretty amazing. In addition, getting that experience working as a student therapist and their exposure in clinicals, they are sought out by the hospital systems that we have as clinical sites. So the majority of our students prior to graduation are employed with their full-time job that they're going to have after graduation. So that is definitely realistic that they will be hired and ready to go before they even finish the degree.
Sure, yeah, that makes sense. So, here on this slide, we have kind of different locations and places that students oftentimes find themselves working after they've earned their degree, or like you said, oftentimes while they're still earning that degree. So if you want to touch on a couple of these places, maybe where students end up finding themselves employed, and then also talk to us about maybe any kind of degree advancement or certification advancement that students, do they need that to continue on into the career, or what does that do to help them advance their career if they go on to potentially earn advanced degrees or specific certifications? Does that, projected employment, what does that look like for them?
Of course. So the wonderful thing about this is that you can certainly stop at the associate level, get your associate degree, and you can work in any of these areas that you see here. You can work in the acute care hospital. You can get right into working in the intensive care units and the emergency department with some probably extra on-the-job training and things like that. You can work as a flight therapist on a critical care flight team. You would just work your way up to that in those hospital systems and go through their training. There are some additional tests you can take to become certified in certain areas, like to specialize in neonatal pediatrics, to get certified in pulmonary function testing. You don't necessarily need those right off the bat to start in those fields, but those are certainly certification you could take to move forward. Um, Also, I want to mention in terms of progressing beyond the associate level, we do encourage therapists to move forward and get their bachelor degree. We actually have an online, 100% online bachelor completion program that students can go through. And that has been wonderful so far since we've started that. In addition, very exciting in the field of respiratory therapy right now. We actually have at Ohio State University has started the very first advanced practice respiratory therapy program. And this is actually a new mid-level provider that's going to be available soon. It's very exciting. So many people might associate this with a physician assistant or a nurse practitioner. So those are what we would call mid-level providers that kind of practice and function as a physician at that mid-level. So these advanced practice respiratory therapists are going to be practicing in intensive care units or in physician offices. It's very difficult for patients to get in to see a pulmonologist because there are so few. So this is going to be a great option for them. So there are certainly many avenues to kind of stay where you're at or advance a lot further with respiratory.
Wow. Megan, that is wonderful news to hear. And, we always encourage our students to see an associate degree as a stepping stone to something else if they want that. But also great to know that you could enter the field with an associate degree.
Right.
And for some students, that is going to, be the thing that works for them at this point in their life. And that is totally okay. What does some of the coursework look like for respiratory therapy? Our students at Geauga and Twinsburg, will be starting this program online, through Zoom, doing their lectures and such. So, we don't need to go through every course in the catalog, but generally, what can a student expect in terms of, course sequence and progression over their time in the program?
Well, we start off, obviously your other courses, you're going to be taking your science courses. But for the respiratory therapy courses, we start off focusing on, an introduction, focusing on the anatomy and physiology specific to the cardiopulmonary system so we can have a really good foundation. And then we start to build on that with different therapeutics that we provide, therapies we give patients. And then as the program progresses, we move into focusing on some specialty areas, neonatal pediatrics, which has been my specialty. I spent 10 years at Rainbow Babies and Children's Hospital. So I do some adult care, but I'm primarily a neonatal pediatric specialist. Also, we get into mechanical ventilation. So respiratory therapists actually manage the devices that breathe for patients who cannot breathe for themselves. So we spend a significant amount of time, more than any other profession, learning how to manage these machines. As far as the environment goes, especially for these students with our whether we do Zoom or whatever remote technology for the courses. So the courses will have lectures. With the courses I teach, we do a lot of interactive lectures where I might have things that are posted online that they can go through and interact with, or it might be a live session like this where, we can communicate on Zoom or other technology. And then, of course, we have on-campus time in the lab where they can actually get hands-on with the equipment and practice with the mannequins prior to hands-on time with real patients in the hospital. So we kind of, set the foundation with the lecture. We do a lot of practice in the lab, and then students get tons of time in clinicals in the hospital settings, learning how to provide patient care on real patients.
That's awesome. Yeah, it's nice to know that you build them up to, make sure they have all those skills that they need before you're throwing them into a setting where they would be interacting with real humans. I know if I was a student, I would definitely appreciate all that lab time and kind of prep to get me out there. And, obviously, working up to that by the time you're ready to go out into clinical situations and things like that. I'm sure that students are excited to put those skills to use, which is awesome. But so Megan, in your experience, you know, this could be maybe a recent student. Do you have a student that you have worked with here at Kent State that has gone on kind of like a student success story? We like to ask about students, if you know where they ended up or what they're doing, or if they've, you know, how they've advanced in their career.
I have so many. I don't have, I don't have a specific one.
That's good. That's good.
One of my favorites, since I do still work in the acute care setting, is working with my students that have graduated. So my coworkers are former students that I've had, and it's pretty awesome. Also, we have had students that, you know, were really passionate about getting into neonatal pediatrics. We have 2 recent graduates that ended up hired full-time at Rainbow Babies and Children's Hospital right at graduation, and went there full-time, and they're loving it. We've had students get into management who manage a respiratory therapy department,
Wow,
that have gotten into education. So a lot of
that's awesome.
success stories.
Lots of success stories. I like that. That's good to hear. And cool that, you know, some of your students end up being your peers in settings like that. Like, how neat to work alongside them and, you know, see them be successful. That's really cool. I like that a lot.
And we know the program is small, so you really do get to know your students.
Very much.
And then, you know, obviously, as Bethany and you have both talked about, the you know, ability to work alongside them in professional settings and watch them, you know, to continue to grow. And I'm sure they still look to you for your mentorship and your leadership in that setting. Megan, is there anything else before we wrap up that you would like to share that maybe you haven't had a chance to talk about? We know respiratory therapists are, you know, very vital and critical parts of our healthcare system. I mean, breathing, we all breathe. We all need to breathe. And certainly COVID-19, I think, has brought your work into the forefront a little bit more. Sad that it had to be through that. But, you know, just as we wrap up, is there anything more that you would like to say about the degree at Ashtabula, the field, anything that might be helpful to a student?
I think I've covered everything I can think of. I just want to say, I mean, like I said before, it has been such an amazing experience for me. All of the patients you get to work with, they're so inspirational. Whether you work with children or adults, watching what they go through and how strong they are to make it through some really difficult situations, and being able to be with them and be a part of that, it feels amazing. So, and I mean, you literally are saving lives every time you go and work a shift. So it's very rewarding.
That's awesome. Yeah. And I think, like you said, Marilyn, I think, you know, 2020 kind of has brought respiratory therapy to the forefront. Unfortunately, this, you know, the circumstance surrounding it, but we're seeing a lot of people who are looking for ways to help and to be, you know, involved. And if students are looking to be involved, you know, in a health degree, respiratory therapy sounds like a wonderful one for lots of reasons, but especially because it seems like you know, since we've kind of started this partnership between our campus locations, everyone that I've spoke to that has worked in the field or is currently working in the field has a passion for people and for helping people. And I think that that is something that, well, I mean, we need more people helping people in our world in general, but I think it's really cool to be able to offer a degree with students and kind of really talk to them about how they can help people. So Megan, thank you for sharing about that. As we kind of wrap up. Yeah, anytime. We're excited and we're excited to send students your way. So we're going to talk a little bit before we completely finish about the admissions process. So on the screen here, you can see Marilyn and myself. So Marilyn is primarily located at the Twinsburg Academic Center, and I am located at the Geauga campus in Burton. And this is a partnership program between our campus location and the Ashtabula campus. So we've talked about it a little bit, but basically what that looks like is you would do your coursework on our campus locations or, online via Zoom, and spend some of your lab experience time at the Ashtabula campus. So if you're interested in what that looks like, or that's confusing to you in any way, shape, or form, please feel free to contact Marilyn or myself, and we can kind of go through what that process looks like for how the program is outlined in our campus partnerships. So our contact information is there on the screen. I'm going to switch the slide here, and Marilyn can talk a little bit about the application process itself. So let me do that here.
All right, so to apply to our campus is pretty simple, actually. You'll go to our website, kent.edu/Geauga, and there are apply now buttons at the top and in the middle of the screen. You'll go there and you'll select the appropriate term and your appropriate student type. So if you've just graduated high school and you've not attended any other schools, you'll apply as a new freshman. If you have attended another college or university, you'll apply as a transfer student. And if you've already earned a bachelor's degree from another institution, you would apply as a post-undergraduate student. And we do have students who do fall into that category. Many of our allied health fields become kind of a career switch for some people, and we're happy to accommodate you and welcome you. After you apply, as part of the application, you will be prompted to pay an application fee. However, we do offer fee waivers for those students who may be unable to afford the $40 application fee. So please contact us at geaugaadmissions@kent.edu, and we'll be happy to discuss those options with you. Finally, you'll want to submit official transcripts from all of the schools that you've attended, including your high school, and certainly any other colleges or universities that you've attended. That way we can do a transfer credit review with you. I'm stumbling over my words today, sorry about that. And those transcripts can be sent through the mail to our Geauga campus in Burton, or they can also be sent electronically through the various transcript services that are out there. Step number 4 is optional, but we certainly encourage all of our students to apply for federal financial aid by using the free application for federal student aid online. That opens every October 1st. And if you need help completing it, just give us a call or contact us. Our friendly financial aid team will be very happy to walk you through that. So those are the steps to apply. Again, if you do have any questions about admissions, or if you'd like to be connected to Megan at the Ashtabula campus, please email us at geaugaadmissions@kent.edu, or give us a call at 440-834-3777.
Awesome. And we'd be happy to connect you. If we can't answer your questions about respiratory therapy, we would be more than happy to connect you with Megan. So Megan, thanks for joining us today and participating in this recording. And we hope to use this as an outreach to lots of future respiratory therapy students.
Wonderful. Thank you so much.